Okay, dear student, today we're going to learn about the sixth video for the P2 MCQs. Let's see here the first question. Three large openings in the diaphragm are at levels of the following thoracic vertebrae. What are those three large openings? We got here the opening for the inferior vena cava, for the esophagus, and for the abdominal aorta. So we got here the T8, T10, and the T12 respectively. So the best answer here is the C. Next we go to the question number 2. All the following structure course through the inlet of thorax in the median plane except. So everything is in the median plane exception. Trachea is in the mid plane, esophagus in the mid plane, thymus is also coming in the mid plane. So left recurrential nerve is the correct answer here. Here we can see. Next question here, the suprapleural membrane is attached to anterior aspect of clavicle, no. Upper border of scapula, no. Inner margin of the first rib and its cartilage, that is the correct answer. Transfer process of the sixth cervical vertebra, no. Let's have a look here, that is attaching to the inner margin of the first rib and its cartilage. The outlet of the thorax is highest in which of the following lines? If we look at it, then you can see that anterior medial line here, it is the highest. So see that the anterior medial line, the B is the correct answer. Next we got here question number 5. Which spinal nerve is affected in thoracic inlet syndrome? Mostly the thoracic inlet syndrome. Let's have a look here, that when the cervical ribs forms, okay, so that is the first thoracic spinal nerve will be involved in it. Next we got here the transfer diameter of thoracic cage increased by. Let's have a look there how it is increasing. The bucket handle movement, when the elevation of the laterally the shaft of the ribs will move upward, just like the bucket handle, then it will increase. So bucket handle movement of the ribs, the B is the correct answer. Let's go to the next question here. We got the question number 7. Anteroposterior diameter of thorax increased by. Have a look on the explanation. The anterior posterior diameter, when it's increased, just like the pump handle is moving, okay, superior and inferior movement of the sternum. So here we go, the pump handle movement of the ribs. So the A is the best answer here. Next we go to question number 8. Which one out of the following is the primary cartilaginous joint? Cartilaginous joint is talking about the primary. So here we see that the first rib and its costal cartilage here, that is a fibrocartilaginous. So that is the correct answer here, the C, the first costal canter joint. Question number 9 here, we got which of the following ribs articulates with one vertebra only? So here we go, first, second, third, and the fourth. So I will choose the first one. First one is that which is only articulating with his own vertebra. Next we got here the question number 10. The tubercle of typical rib articulates with the facet on the transfer process of. So when we talk about the tubercle, we are not talking about the head, we are talking about tubercle of the typical rib. So it is articulating with its own vertebrae, okay, as we can see here. So up to here, thank you, see you in the next video.